if you're unhappy with your glasses or contact lenses and looking for ways to get rid of them, we are taking a deep dive today into various types of surgeries to get rid of glasses. I'm Dr. Tushar Grover. I am the Medical Director and Consultant at Vision Eye Centers in New Delhi. So for those who are unhappy with glasses, surgery can be a transformative experience. It helps you see the world very clearly, often even more clearly than you were seeing with glasses, and you lose complete dependence on spectacles. So starting out with the type of surgeries that are available today, I'm sure you might have heard some of the names, but here we are going to describe different types of surgeries, what are the advantages of each, what are the disadvantages of each, and what might be best suited for you. So starting out with surgeries that are done on the cornea or corneal procedures. So these are essentially surgeries that are intended to reshape your cornea so that you can get rid of spectacles. The first variety of surgeries involves surface procedures. This includes procedures like PRK, Epilasic, Epicontora. Now these essentially are meant for lower refractive errors. They give you extremely good visual outcomes in the long run, and for these low refractive errors, like I mentioned, are pretty much as good as any other corneal procedure in terms of visual outcomes. The advantage that you have here is that your cornea is being altered minimally, which means the shape of your cornea is not being disturbed too much. The thickness of your cornea is not being reduced too much. So in terms of the long-term health of the cornea, this is an extremely good procedure and probably the safest procedure for long-term strength of the cornea. The slight disadvantages of this procedure includes the fact that you will have a slight pain or a slight discomfort for the first few days, for the first 2 to 3 days after surgery. The visual outcomes are extremely good, but there can be slight fluctuations in your vision for the first week or so after the surgery. But long term, after a few months, even a few weeks, your visual outcomes are going to be as good as LASIK or the lenticule based procedures that I'll be talking about next. So moving on to LASIK. LASIK is probably the most commonly talked about refractive surgery, the surgery that you might have heard about before, the surgery that is most commonly performed. And this essentially involves creating a flap in your cornea and then doing a laser to reshape it. Now, this can be a variety which is done with the blade, or it can be bladeless. The blade variety is becoming much lesser common now because we are not doing it very often because the safety here is inferior compared to the bladeless or femtosecond LASIK. In blade LASIK, there is a blade that is used to create that corneal flap that I just spoke about. So there is a slight risk of the flap not being created exactly how it was intended to with this variety, which is why this variety is now becoming extremely uncommon, and what we are essentially doing is the bladeless or the femtosecond laser variety of LASIK. Now this comes under various brand names that you might have heard of. There are brand names like iLASIK, like Contora, and various others, and all of them are essentially doing the same thing. They are advanced forms of the same variety. Now visual outcomes with this procedure are extremely good. Visual recovery is quite fast, and the wow effect that you get here in this particular procedure, the wow effect meaning how you feel on the day after surgery, is much more in LASIK than in any of the other procedures, whether it is surface ablation or it is the lenticule procedures or it is any lens-based procedures. So the outcomes are usually best at day 1 in any form of LASIK. So having spoken about LASIK, the next variety is the lenticule based procedures. So the brand names you might have heard of here include Smile, include Clear, there is Silk ELITA. All of these are lenticule based corneal refractive surgeries. These also provide extremely good visual outcomes. The visual outcomes are essentially similar to LASIK in the long term. The wow effect that I spoke about, which means how happy you are on the day after surgery, is comparatively lower in these surgeries as compared to LASIK. However, there are slight advantages that are there here as well. Say somebody is a sports person, or somebody is planning to join the armed forces. These procedures essentially don't have a flap that is created, which is why for these particular professions, these surgeries might be better suited. So the visual outcomes in these procedures is essentially similar, but which procedure is best for you can be recommended to you based on your requirements. So moving on to the next variety of surgeries, which is the lens-based varieties. Now, these are essentially done in individuals who are not eligible for a corneal surgery, such as those who have a very high power or those who have a thin cornea or an unhealthy cornea. The varieties here include what is called FAKIC IOLs and refractive lens exchange. FAKIC IOLs are surgeries where a lens is implanted inside the eye, which is placed just above the natural lens of your eye. So again, there are brand names here. There is something called ICL, there is an Indian brand called IPCL, and there are others as well. All of them essentially are very similar in terms of the results that you get. And all of them give you extremely good visual outcomes. The reason why this is our second option, which means the option in patients who are not eligible for corneal surgery, is because you're entering the eye. You're going inside the eye here, whereas in corneal surgeries, you are just doing a laser on the cornea. Therefore, whenever you're entering the eye, there is a slightly higher risk of infections, there is a slight possibility of cataracts developing early on, slight possibility of pressures going up. All of these are possible risks associated with the surgery. However, chances of serious complications are extremely low, and this procedure is extremely safe in an experienced hand. The next variety of lens-based surgeries is called refractive lens exchange. In this, the natural lens of the eye is removed and an artificial lens is placed. So this is essentially very similar to what is done in a cataract surgery, except that here we are doing it to get rid of your glasses. Now this again is done in patients who are not eligible for any other surgery, whether it is corneal surgery or it is FAKIC IOLs. So this can also be an option for you if you have a very high power or if you have other reasons where you cannot undergo the other procedures that I spoke about. Now, whether you wish to undergo surgery for spectacle removal or you do not wish to undergo surgery for spectacle removal is a completely personal choice. It is an individual's decision to get rid of glasses. However, which surgery is right for you is something that you should definitely discuss with your treating surgeon. And all the surgeries that I discussed with you just now are all extremely safe and they give you extremely good visual outcomes, and we frequently see lives changing because of the individual's ability to get rid of spectacles. So it's a life-changing experience, has extremely good results. Like any procedure on the human body, there are minimal risks involved, and it's important that you discuss these risks and benefits with your treating surgeon and get the procedure that works best for you.